The next time I went to Stoke, Chris was about to go and see his gender specialist to discuss the possibility of being prescribed cross-sex hormones, the hormones that will start to turn his body into a female. Do you desperately want hormones? You're not in two minds about that?
I'm not in two minds about that. I need them to get further, really, so I can feel better about myself and better about myself physically.
At 18, Chris was eligible for feminising hormones, but his doctor needed to be sure that he was ready for this huge step. What do you think he's going to say?
What I'd like him to say, and what he's going to say is probably going to be different, you never know. But I'd like him to say, yeah, okay, you've proved yourself, here's your hormones. But you never know, that might be wrong, because I can get my hopes up and it might not happen. So, you never know.
It was by no means certain, as there are no definitive rules. British doctors have only rough guidelines to follow, and these err very strongly on the side of caution.
I'll feel upset if I don't get given hormones. I will. I'll feel pretty upset. I'm going to try and dress a bit more feminine for him, just so he can kind of see that I'm putting myself out.
When you give a cross-sex hormone to an individual, that individual will, for the first time, be exposed to concentrations of hormone which their body would not normally encounter. So in a male to female, female hormones would lead to development of breast tissue, and you get a female fat distribution, so rather wider hips.
Okay, see you later.
I'll see you.
Good luck.
Thank you.
How are you feeling?
Emotional.
Are you worried about this appointment?
I'm not worried. I'm just, I don't know. I just feel if he's given hormones now, then there's no going back. I think, yeah, if he has hormones, then that'll be it. But that's what Chris wants. So he'll be disappointed if he doesn't get it. And, you know, I've just got to accept it and, yeah.
If Chris were given feminising hormones, there would be no going back. Once breasts have started to grow, the change in the body is irreversible.
I got what I wanted, so I got the hormones, so that's made me really happy. He recognised that I'd done a lot. First thing he said is, "Wow, you look nothing like a man." First thing he said was that was really flattering. And then he said, "Yeah, I think the next stage is hormones," so that's brilliant. Very happy.
Martin, how does it feel that your son will eventually become your daughter?
It's a difficult question, really. I mean, it's going to be a big change, no doubt about it. But he isn't changing to become my daughter, because basically that's what he's always been, it would seem. So all we're doing is changing Chris into what he always has been. He's living a lie at the moment, so basically we're changing that lie into a reality.
Chris was ecstatic, but living a lie had led to a miserable adolescence. For any child with gender identity disorder, seeing their body develop during puberty is traumatic. 53% of adolescents with gender identity disorder attempt suicide at some point. But doctors can now intervene to put puberty on hold.
There are some drugs which have been formulated that can stop the pubertal process. They are totally reversible, and within a few months of discontinuing the treatment, you would expect the normal rhythm and cadence of puberty to restart.
The purpose of the puberty blocking hormones is to give the child and the clinician some more time to really think the consequences over, and to allow the child to make another decision.
There is no consensus amongst doctors as to when exactly to start giving puberty-blocking hormones, but normally they will only be prescribed after the child has been through much of puberty. This is in case the natural flood of hormones rids the child of their gender identity disorder. Although desperate to be given the puberty blockers earlier, Michael had to wait until the age of 16.
So how many injections have you had then?
This is my fourth one, I think. He's been on stoppers for a year this month. Doesn't have the period. Stopping the growth of the breast, God forbid, if that would have carried on, you know, it has made his life a lot easier.
I've got hairy armpits. Don't look at my armpits.
He's got a hairy body.
He would have given anything to be given the stoppers as soon as he started his periods. Anybody going through puberty is difficult. If you can imagine a child at war with its body, and all of a sudden they've got these periods, I'm a boy, breasts, it's horrendous. It's really horrendous.
I think there's always individuals where it appears to be utterly persuasive and where there may be great temptation to intervene much earlier to make the outcome perhaps more comfortable for that individual earlier on. But in general, most of us would respect the rules that operate in the UK at any rate, that we allow these individuals to complete a natural puberty. Bearing in mind that we know that many individuals resolve their problem with time, suggests that this type of approach is vindicated.
But for Stephanie and Neil in the States, the thought of waiting until the end of puberty to intervene with Reggie terrified them. Are you worried about what's going to happen during puberty?
Well, I think it's going to be very hard. There is the possibilities of her having erections and nighttime emissions, and I don't know how she'll be able to handle that because she has no idea about any of that yet.
I can't imagine being a little girl at 13 years old, and while all my little girlfriends are growing breasts, I'm growing a mustache and a beard. If she starts to grow a beard, I see a suicide child.
Doctors disagree about how to treat children with gender identity disorder. Some clinicians are beginning to push for the more radical approach of much earlier intervention with puberty blockers to help prevent the trauma of puberty.
My bias is, which is not agreed to by many other clinicians, is that rather than wait until a lot of puberty is showing itself to see how the child reacts to it, if a child really looks like he or she has gender identity disorder, I would argue that puberty, once just is about to begin, should be blocked.
This buys some time for the child in case they decide they don't want to change gender after all. But they can only take puberty-delaying hormones for a short time because there's a risk of brittle bone disease.
It gives you about a year, maybe a year and a half, to see whether gender identity disorder continues. If it doesn't, fine. You stop the blocker, puberty goes on. If it does continue, the next logical step becomes cross-sex hormones, which allow the kind of puberty that the other sex would have.